how proud I am of my fellow Pennsylvanian and the second Murphy now to join the 30-something working group, along with the gentleman from Connecticut. He is someone that we look to for his expertise, having been in the field of battle and having served in this conflict. And I really am excited to hear that he's going to be joining us now with the 30-something group to talk more about these issues. And he definitely has a unique perspective that he's adding. So I was excited to hear his voice, and I'm very proud to hail from the same state. I wanted to talk a little bit about one of the consequences of this action that we're talking about, as Mr. Meek brought up, is the fact that we are creating, through our actions in Iraq and Afghanistan, hundreds of thousands of new veterans are returning to this country, many of whom are returning seriously injured. We have over 25,000 that have been injured. We're approaching 4,000 killed now. And those that are returning and are going to have to use the VA system are going to find, thankfully, that for the first time in the history of the program, 77 years of the Department of Veterans Affairs, we have increased funding at a rate that has never been seen in the history of the department. We are up to approximately $15 billion in increased funding for the VA in this Congress. And as every member of the 30-something working group knows, and certainly every member of this House knows, this is a priority issue for me. Funding for Veterans Affairs has languished in the past several years, unfortunately, but this Congress has stepped up to the plate in a bipartisan way, I will say, to give the Veterans Affairs Department, especially the health accounts, the necessary funding to take care of these hundreds of thousands of veterans that we're creating in Iraq and Afghanistan. These are men and women who have fought bravely, people like Mr. Murphy from Pennsylvania, who have put their lives on the line, who have left a family behind to do this and have made every possible sacrifice, and they deserve to know that they can count on the United States to give them the health care that they deserve and that they have earned, that they've been promised when they entered the military. So we voted in just the first 5 months here in this Congress to increase funding by $15 billion for the VA. And significantly, for the first time ever, we exceeded the recommended independent budget request of the service organizations, the American Legion and the VFW and others. I want to repeat that point for my colleagues. First time ever, Congress exceeded the request of the service organizations. I think that's something we can be proud of. We talk about the enormous achievements we've had in the first 5 months, the many bills and the different subjects that we've addressed, the fact that we have paid attention to and finally moved forward with our Veterans Health Care Facility in a way that is unprecedented in the history of this country is, I think, one of the things we can be most proud of in our first 5 months in office here. And some of the things that this funding is going to allow us to do, we're going to be able to hire more doctors and nurses and improve medical services at the VA. As we saw with some of the Department of Defense facilities with regard to health care and Walter Reed, chronic underfunding can lead to some disastrous consequences, and we need to make sure that we don't allow that to happen in our VA system. So this bill is going to improve the quality of care. I have in my district a Department of Veterans Affairs hospital that's undergoing a $100+ million expansion right now, and hopefully when that is done, we're going to have in my district the preeminent health care facility in the entire VA network. And I want every VA facility to have that type of access across this country. Our veterans deserve nothing less than the highest quality health care this nation can provide for them. We're going to reduce waiting times. We have a backlog at the VA, unfortunately, of nearly 500,000 cases. And every member of this House knows you probably have the same experience that I'm having in my office of people who are calling, frustrated veterans who want to access the VA health system, but they have to wait. They have to get in line, and it's a very long line. weeks or months of waiting because of that backlog, nearly 500,000 cases. The bill that we passed in this House, the legislation that we've passed, is going to go a long way towards improving that situation.
Mr. Altmire,
I would
you
yield.
yield just for a second. I just want to, Mr. Murphy, I just don't want it to go by. I mean, you're talking about what we just passed before we left. I mean, received the funding for it with the major fight with the White House. I mean, the president wanted to veto it. He said, that's not what I asked for. Meanwhile, Walter Reed was still standing by for the dollars to be able to make the corrections that they need to make. We know that we passed the chairman's, Mr. Skeldon's bill, Armed Services bill, off this floor that helped us with